Hello, everyone. Just trying to adjust my camera here for those of you on Instagram. Give me just a second. Hopefully, you guys can see that okay. Um, if not, just say something in the comments and I'll try to adjust that a little bit better. Today, we are going to be talking about pet health and wellness. So, this is a pretty big topic here in our facility just because we do have that high volume of pets coming into the facility, and that can bring a number of different illnesses and diseases with it. So I just wanted to definitely get you guys more information on that so that you have a better understanding of some of the things we're doing upon intaking of the pets as well as sustaining them through their time with us. So this does have some images, nothing too terrible, I promise, but some of the less great looking things that come along with some pet illnesses and parasites and things of that nature. So again, I don't think it's anything too horrible, but for those of you who may not be familiar with some of these things, it might be a little bit more graphic than you're used to. But I did not put any images in this presentation that are um, extremely horrible. So, moving on. When pets come into our facility, most of the time we have no idea where they have came from. We really just don't know much about them at all. The only information we have regarding their health is typically going to be whatever they have received or has been done to them upon arrival. So once in a while we will get some pets that are owner surrendered. Maybe they have some health records from their veterinary or former veterinary care. Um, Not very often though. So when they come into our facility, all of the dogs are going to get their DAPPV and their Bordetella vaccines. Um, the DAPPV and Bordetella, those are core vaccines. The Bordetella is not necessarily a core vaccine for a personal owned pet. This is something that if you're not boarding your dog at a boarding facility or taking them to dog parks or things like that, it's more of an optional vaccine. However, in our facility, because of the high volume of dogs that we're going to be having in there, this is core for us because that one is going to prevent kenneled cough in the dogs, which is definitely a fast spreading issue if some of these guys come in, especially on our stray side, if maybe we can't vaccinate them right away due to behavior or something of that nature. So we definitely want to make sure all of our pets do have that vaccine on board. And of course, your DAPPV is for distemper, adenovirus, parvovirus, and parainfluenza. So across the board, all dogs will receive those upon arrival unless we know the previous owner and have vet records on file for them. We also are going to vaccinate our cats upon arrival with FVRCP, which is for um, rhinotracheitis, colicky and panleukopenia. You guys know from orientation that panleukopenia, or panleuc for short, is something we are definitely always concerned with just because of how quickly it spreads and how deadly it can be. Now, for our rabies vaccines, we do not administer those during intake, and that is because we do not have a veterinarian on staff. And in order to administer a rabies vaccine, it has to be done by a veterinarian or under the watch of a veterinarian. So, those particular vaccines will be administered to pets while they're in our spay and neuter clinic. Post surgery, they will get those while they are recovering. So, common disease that's going to come in primarily with puppies. Puppies are very infamous for parvovirus and spreading parvovirus. I think the worst part about, parvovirus, especially in puppies, is that puppies tend to be very appealing to people, and when people see a puppy, they want to pet that puppy. It is cute, it is snuggly and furry, and everybody wants to pet the puppy. When I personally see a puppy, I am hesitant to touch that puppy because I don't know if it has parvo or not. So we're very cautious with puppies. When puppies come in the facility, you really want to pet them, you really want to hold them and snuggle them because they're so cute, but we try not to, just because we know any puppy, regardless of how it appears or is acting, could potentially have parvo. Parvo is just kind of everywhere, and it's hard to get rid of. So some of the signs of parvo in dog is going to be, lethargy, loss of appetite, fever, vomiting, diarrhea. Just overall, they look unthrifty. However, some of these signs are kind of across the board when it comes to any pet illness. So you'll see a lot of symptoms between parvo and distemper that are very similar. But there will also usually be some distinctive signs as well. So it can spread very quickly. Most commonly in our facility, when we see yellow vomit, lethargy, a puppy that is overly calm, that is when we lean towards the concern of it having parvo. If a dog, and it doesn't have to be a puppy, if a dog comes to our facility and we're concerned that it could have parvo, we will run a test on it. Once we conduct that test, if it's positive, we will get it to the vet. Okay? Not too often do we have dogs come in with parvo or come down with parvo and pass away in their kennels. It's quite rare. We can see those signs, and we usually have a small window to get them the care they need. And a lot of times we are able to get that treatment, and they go on to be fine, get adopted out, live their full life, they're okay. But it is something that we see more commonly than other diseases in our shelter. So another common one is distemper. Now, it's not as common as parvo in our facility, at least. However, it does exist in the community. I have seen it in dogs from the community, and it is pretty horrifying, actually, seeing dogs with distemper. Now, while they have some of that, parvo-like symptoms as far as the lethargy, the fever, not eating, one of the very consistent telltale signs of distemper is the muscle twitching. You will often see it, foreheads, back end. They have an uncontrollable twitch that is very in line with distemper. So it does affect their nervous system. They will have a lot of, especially nasal discharge. So it's a difficult thing to see, but we are very fortunate that we don't see too much of this in the shelter. And again, those signs, we get them to the vet immediately for something like this, just because of the severity of it. Whoops, wrong button. All right. And then as far as adenovirus, parainfluenza, we don't see too much of this in the facility. Personally, I don't believe that I have seen it in person in a pet. Again, lethargy, weakness, loss of appetite, fever, vomiting, diarrhea. Pretty consistent with some of these other ones, but a little bit more extreme cases, blue eyes, cloudy corneas, if it's the respiratory infection, persistent coughing, nasal discharge, gagging, difficulty breathing. A lot of these things are so across the board in some of their symptoms that you have to look for the other indications or rule out other things. So obviously, if we were seeing this type of symptoms in a pet, we would first test them for parvo. If that comes back negative, we now know we have something a little worse. that we're dealing with here, and we will again direct them to a veterinarian. We work with several vet clinics in New Braunfels, and they're very good about seeing our pets and providing treatment for us. So don't see this one very often, but it is important to know this is one of the diseases that is going to be covered by the DAPPV vaccine. Now, panleukopenia is going to be in our cats. The FBRCP vaccine is to prevent feline panleukopenia virus. Very similar to parvovirus in dogs as far as the symptoms go, the vomiting, the diarrhea, fever. They will be pretty lethargic. The problem with this particular disease is that it is very quick acting. A lot of times, by the time we notice symptoms of this, especially the vomit that we see that is consistent with Panleuk, it's usually too late to treat by that time. If we have some come in that are displaying symptoms of this, a lot of times, by the next morning, they might be deceased in their kennel. So that is why we have that, our stray cat area is off limits to volunteers and everyone. Guests, it doesn't matter who it is, we try to keep it staff only just because if this comes in, it will spread quickly. We have tons of kittens in our facility, young cats that just don't have the immune systems of some of the older cats who may have come from a home where they've been vaccinated their entire life. So it's just too much of a risk to allow multiple people in there that could be spreading germs from one cat to another, especially if it's not showing symptoms yet, but the virus is active in their system. Now, calicivirus and rhinotracheitis, we do see this as well, especially calicivirus. One of the giveaways with this one is the mouth ulcers. So you will see sores inside of their mouth. We have had this in our cat ISO, cats with calicivirus. It can cause long-term issues. Typically with these guys, sometimes they can make it, but you have to treat the symptoms, and that's all you can do. You cannot get rid of it. It's never going to go away. It's chronic. They're going to have it for life. And you can kind of try to help with the systems throughout its life, but it's not going to be ideal. I think in these situations, it's kind of one of those where you want to determine if the quality of life is going to be there. Sometimes the situation is worse in one cat versus another. It's kind of a basis thing. It depends on the overall health of a cat. If it's going to be a little tiny kitten, they might not be able to get through this. Whereas if it's an adult, older cat, again, that may have had vaccines previously in its life, it might be able to continue being great in a household, just as long as some of that symptomatic care is given to it throughout its life. So, is it something we deal with every single day? Absolutely not. But yes, we do see this from time to time. Now, when talking about prevention, obviously we're giving our vaccines to all the pets on arrival, but we are also providing them with prevention. So everybody, cats and dogs, is going to get an oral dewormer on arrival, and then they are going to receive that on a regular basis until the time that they leave the facility and are adopted out. Same with flea and tick treatment. So flea and tick treatment is topical. It goes on the back of the neck, and that is a monthly. So they get that monthly prevention for the remainder of their time while they're in the facility. Once they go into a home, it is then obviously the owner's responsibility to provide these things for it. Now, for heartworm prevention, we only are able to regularly administer that if we have received large amounts of heartworm prevention donations. And before we give that to anyone, we also want to conduct a heartworm test. So we are going to do that for all dogs over 6 months of age. If they are positive, we will not give them prevention. They need to be in a foster home and receive treatment before they can be put on prevention for that. If they are negative and we have prevention available, we can administer that to them orally while they're in our facility. This one is not a guarantee, just because we do rely on donations of that to be able to use it for our pets, but if we have it, we will administer it. So parasites are a common theme in our facility. We see a lot of different ones, some more common than others. The most common one is going to be tapeworms. Tapeworms are brought on by fleas, so we see a lot of tapeworms on pets that come in, especially if they're covered in fleas. You can almost guarantee they've got tapeworms too. So tapeworms, heartworms, of course, are from mosquitoes. We don't heartworm test cats. Yes, they can get heartworms, but it's pretty rare. The heartworms definitely prefer canines over felines, so that's where we're seeing it, and it's going to be those older ones that have had more exposure to mosquitoes, so over 6 months of age. Hookworms, we see those, not as much as tapeworms, but we do see those, as well as whipworms are pretty rare for us, I feel like. Roundworms are more common, but a lot of times, especially with the hookworms, the roundworms, a lot of times we see that in puppies more than adult dogs. So a lot of nasty critters could be residing in various pets upon arrival. Some of the common dog illnesses, and this is going to be definitely based on what we see in the shelter. I definitely want to gear towards our facility just so you guys are aware of kind of what we're dealing with on a daily basis or a common basis, rather than other areas, because every area, depending on state, location, is going to be slightly different to what they're exposed to. But for us, we do see a lot of skin allergies. I am a Texas transplant, and I never had allergies in my life before coming to Texas, so there's a lot of them out there. A lot of rain, a lot of nature, and it affects animals just as much as us sometimes. So we especially see skin allergies on white dogs with the pink skin. Those dogs are just, I think it just comes with their skin. I don't know. But we see a lot of that. We also see sarcoptic mange, also known as scabies, and Demodex. And we'll kind of talk more about those in a little bit. We're going to see quite a few ear infections. We often see this a lot when we're recovering dogs after their spay and neuter surgery. So as we're tending to them, administering rabies, cutting nails, things like that, we'll often have a pretty good overlook of their entire body while they're still under. It's a little easier to see different things that might be going on, and ear infections are pretty common. Arthritis, hip dysplasia, we are going to see a lot of that on our older dogs, our senior dogs that come in, and we have a very high amount of, blue heelers, German shepherds, some of these dogs that are more prone to hip dysplasia in our area. So we will see that commonly. Another common one, Giardia and Coccidia. So you can see those little bugs down there. The Giardia one kind of looks like plankton from SpongeBob, whereas Coccidia looks more like a basket of eggs. Only a couple eggs, because a full basket with eggs under a microscope is actually going to be our tapeworms. So they look pretty similar, really, but once you see enough of them, you can kind of determine which is which. But nasty little bacterias that cause diarrhea in our pets. And then, of course, the final thing, kennel cough. That's not an everyday occurrence. We usually have some of that going around at least once a year. Again, you get that many dogs in a small space that were formerly unvaccinated or maybe even never had vaccines in their life altogether, you're bound to have something happen. So we do see this from time to time, but it's not an everyday occurrence. For cats, the two big ones we're going to see is upper respiratory infections and ringworm. And we'll see ringworm in dogs as well, in addition to the Demodex and scabies and things like that. But upper respiratory infections, you've got the sneezing, running nose, eye discharge, coughing, lethargy, loss of appetite, fever. Um, as you can see, there's a lot of those symptoms are consistent with Kaliki virus, panleukopenia, but what we know about this is that they test negative for panleukopenia and they respond to the treatment for an upper respiratory infection. So we are rather fortunate that we're dealing with URIs as opposed to panleukopenia or Kaliki virus for sure. But this is what you're commonly going to see in cat isolation is cats with this particular issue. And then, of course, we have our fungal jungle, which is dedicated to just cats with ringworm. I think everybody's probably familiar with ringworm. If not, yes, it is contagious to humans. It is not going to kill anybody. It is a skin issue, just a bacteria on the skin. It's itchy. It's disgusting. We definitely gown up, wear gloves when we're handling any pets with ringworm. We are providing them with treatment, and once they are clear of ringworm, we'll move them into the other stray areas or wherever else they need to go. But it's not, it spreads quickly, but it's not severe in a sense of losing a pet over it. It's highly treatable. Most important thing we can all do in order to reduce the spread of germs from an illness or disease is washing our hands. Soap and water, using hand sanitizer. Any pets that are showing signs of illness, we're not touching them whatsoever. If somebody has to touch them, it's going to be a staff member that is providing treatment or moving them or tending to their kennel, and we are gloving up. Depending on the severity of what we're dealing with, we're gowning up as well. So we don't want to touch anything that has any kind of symptoms just until we know what's going on. So you might go into adoption dog or you might go into adoption cat areas. Maybe you see they're sneezing or they have a little bit of, nasal discharge or eye discharge. Don't touch the pet. Let a staff member know and we'll evaluate it. Sometimes we're going to have pets out there, maybe a cat in cat adoption that formerly had a upper respiratory infection, but it's either been resolved or it's at the end of its medication treatments. Whatever the case may be, we might know about it. It might be something mild, it might be nothing. But we definitely want to evaluate each and every one because if it's something, we don't want that something to spread. And then, of course, if you're in any of the areas near doors that have a staff-only sign, please respect the staff-only sign. Again, we have to take extra precautions with these guys that aren't feeling too good because while we can guess what might be the issue, until we take it to the vet and have a definitive answer, we don't always know. So we're treating everybody as if it is parvo or it is panleuk until we know for sure what we're dealing with, and then we proceed as we need to with treatment. So for heartworms, I give it its own slide because this is a big issue in our area. It's hot, it's humid, and it's a perfect environment for mosquitoes, mosquito larvae. So in order for a pet to get heartworms, they have to be bit by a mosquito. So once that mosquito bites them, it is then going to have its babies. It's going to spread as they feed and develop into larvae. It's just nasty. The heartworms might start out mild, but as time goes on, it accumulates so much that eventually, without treatment, they will pass away from congestive heart failure. We're dealing with a pretty important organ here, so this is something that has to be treated. Time is of the essence, and we are unable to treat them in our facility. We'll talk more about that in a minute as to why. But we are going to heartworm test every single dog that comes into our facility that is 6 months or older, because they are the preferred host for a heartworm. If you look in the bottom right hand corner, you can see a couple pictures there. One is actually the exact heartworm test that we use in our facility to test for them. We do that by drawing blood, and then we put that on there as well as a couple drops of the buffer, and then we wait 10 minutes to see if it is positive or negative. Just like with a human pregnancy test, if there's a faint line, it's positive. So after that 10 minutes, we know whether or not they are positive or negative, and the microscope picture there is of microfilaria, which is baby heartworms. It's a photo rather than a video, so it's kind of hard to see, but it's actually kind of fascinating seeing microfilaria under a microscope. You can actually see those baby heartworms moving under a microscope, so it's just another way to do a double check for heartworms on a dog. So when we get a pet that comes in, test positive for heartworms, the only way to start treatment for that pet is to put them in a foster home. So the heartworms are not contagious. A dog interacting with another dog is not going to catch heartworms. It has to come from the mosquito. It's all the information that is provided to our fosters regarding the treatment for heartworms. So I'm just going to quickly go over it with you guys. But the first week, they are going to go into a foster home, and we want to make sure that in that foster home they are comfortable, they're able to acclimate to the home comfortably with other pets. If it doesn't work out, we're going to bring them back in, but we want to know for sure that they're going to be okay and content in the foster home before we proceed with the treatment. So that second week, if things are going well in the foster home, now we can send them to Creekview Vet Clinic, which is the one we use for our heartworm treatment. We can send them there. They can begin getting their injections and medications. They will continue to stay in that foster home. Typically, Creekview will keep them at the vet clinic for a couple days, actually, just to make sure that they're not having any side effects from the injections while they're there. Now, during the 3rd through 7th weeks, they're going to get some medication prescribed by Creekview. While they're getting this treatment, they are going to be crated. It's important to keep them crated so that they are spending the maximum amount of time resting throughout the treatment. While on the treatment, their heart will be beating at an increased rate. And if they are out running around, playing with other dogs, getting rowdy, it could lead to their death. So it's crucial that these dogs are remaining calm. They can go out on a leash walk to go to the bathroom as needed, but the important thing is that they're not running around and getting overly excited. On the 8th week, they are going to go back to Creekview. They're going to get their first dose of Advantage Multi, which is going to include the heartworm prevention, and they're going to stay there overnight to make sure they don't have any reactions to it. And then on week 12, they get that second dose, and this is now the prevention after the heartworms are killed, to make sure that they don't get heartworms again. And then week 16, around the 4-month mark, they'll get their third one. Now, after that, they'll be retested for heartworms, and if it is in fact negative, they can then be adopted out. They are free of heartworms. They're good to go. As long as, they remain on prevention, they'll be fine. They make a full recovery. They do really well as long as they receive their treatment in a timely manner. We don't want to wait until they're showing signs of congestive heart failure because then it's too late. We can't fix something that's that damaged at that point. Um, all dogs should really be on a heartworm preventive, just because of how common it is in this area. Um, However, a lot of people don't always know about heartworms, so um, it's something to think about for sure. I know that growing up in northern state, I had never heard of heartworms before moving to Texas, so it is probably not unheard of that a lot of people, especially transplants, military, whatever, are not going to be too familiar with heartworms, but it is a pretty common issue down here. And you have to remember them being in a crate for, a couple months while they're doing their treatment, it's not that bad because it is temporary. It's going to get them through it, ensure that they survive their heartworm treatment, and then they can spend the rest of their life with their healthy heart playing, having a great time. Before I proceed, I should probably mention we do have a couple of dogs in the facility right now. We usually have at least one at any given time. Right now, we have, I believe it is Jethro and Resnor, but I could be wrong on that, that are heartworm positive, and they need to start their treatment as soon as possible. Especially Resnor, has been with us for a while now. So he is not only a long stay, he's heartworm positive. So these guys need to get into foster care as quickly as possible. This does not have to be a difficult fostering. Really, you're keeping them crated, you're keeping them calm, which is a pretty good foster experience. Just relaxing and with a calm dog throughout their treatment. But if you guys are ever interested in fostering a heartworm positive dog, you can fill out a foster form if you haven't already at hsmba.org. If you're already a foster and this is something you might be interested in, just feel free to reach out to the foster coordinator and they can always provide you with more information on that as well. All right, surgeries. Every pet that comes to our facility that goes through our adoption program will be spayed and neutered before they are adopted out, period. We absolutely will not adopt out any pets without them being altered. There are plenty of cats and dogs in this world. We are not going to add to it. We don't have any room. Other shelters don't have any room. This is a huge, huge problem, and everything needs to be spayed and neutered in order to try and keep up with it. So it is going to reduce the risk of them spraying or marking territory. Definitely, the sooner the better. If you can get them when they're puppies and kittens, that's your best bet. Sometimes you might have to train them a little bit more if they're older and have been neutered at a later time. It's the males, I'm telling you. The males, if they're older, sometimes they've already established their habit of doing so. So sometimes even after spaying or neutering, that might still exist with them. It's something that you're going to have to train out. But the sooner you get them spayed and neutered, the better. It's also going to reduce their risk of roaming. I don't think there's a coincidence that a lot of the animals that come in, the majority in fact, are not spayed or neutered. They're roaming. They can't help it. They're animals. So by spaying and neutering pets, that is going to decrease the amount of strays as well. It reduces aggression. It lowers the risk of certain cancers. And it's going to overall decrease the overpopulation problem that is consistently increasing every single day. And a really cool fact is that it also increases a pet's lifespan up to 3 to 5 years. So more time with your pet. You can kind of see the visual here on the slide of just how many babies a single pet can make. It's a lot. We're talking millions a year. So it escalates very quickly. While it might not seem like, oh, my animal accidentally had a litter of kittens, well, now each of those kittens is probably going to have litters of kittens, and their litters are going to have litters, and it just never really ends. So if we can spay and neuter everything, it will increase our chances of keeping it somewhat under control. So another, um, what do I want to call this? Another thing we are doing to every single pet that becomes adoption ready is microchipping. And we are also microchipping every single stray pet that comes into our facility that gets reclaimed. Now we know there's a chance of them getting out again. This way, next time we can scan them, we can look it up in the file, see whose pet it is, contact them, and they can come get their pet. We don't have to worry about not knowing who the owner is, trying to post to every social media page and website asking if it's anybody's pet. It kind of just bypasses some of that search. So we can go directly to the source of the owners and get them reunited with their pet. So this chip you can kind of see on the end of the finger there. They're pretty small, about the size of a piece of rice. Very small. They are permanent. They are implanted under the pet's skin, right in between the shoulder blades. Everybody that comes in, that's the first thing we're doing, is scanning them to see if they have a microchip. And we're not just scanning their shoulder blades. We are going to scan every inch of their body, because it could happen that the microchip can move around. It might migrate down a leg or further down the back. So we're going to scan the entire pet for one, and hopefully they have one. Now, on the chip scanner, when you are scanning it, it is not going to pop up with the owner's information, phone number, address, any of that. The only thing that's going to pop up is going to be I'm not sure how many digits it is. It's quite a few numbers, and we'll have to take that number and look it up in the system. If it's not in our system because it wasn't microchipped by us, we do have different manufacturers that we can call to try and get information on who the owner is. So it's kind of a process. It does not share personal information on the scanner. It's just going to tell us the microchip number. So some of the myths associated with microchipping is that maybe it's only for dogs or only for outdoor pets. That is not accurate. Any pet can be microchipped. I have a miniature horse. She is from a rescue and she is microchipped. People have microchipped pigs, guinea pigs, ferrets. You can microchip whatever pet you want, okay? I'm sure there's some exceptions, but it is not just for dogs or pets that are outdoor. Even if you have an indoor only pet, guess what? We have had indoor only pets be picked up by animal control and brought to the shelter. So if you want to be reunited with your pet in the event that it gets loose somehow, runs off, whatever the case may be, this is your best chance. And just as an example, if you think about what is currently happening in Texas and other parts of the country now with the flooding, those pets might have been the best pets. They've never gotten loose. They were indoor pets only. There's a lot of instances, but you know what? You never know what life is going to throw at you. And in those moments, a microchip is sure going to help. Because once animal control, if it's taken into a vet clinic, wherever it's taken that they're able to scan, they're going to be able to reunite you with your pet. So you never know what life is going to throw at you. You don't know what's going to go on in the world. So, I mean, microchip your pets. I can't stress it enough. Another thing that a microchip is not is a health or activity tracker. That microchip is not going to tell us anything about your pet. It's blood sugar, overall health, dehydration levels. It is not a health tracker. It does not track their activity. We don't know how many miles they ran off. None of that information is on the chip. Again, it is just the number, the microchip number, that then has to be pulled up in a system, either by a shelter or a veterinary clinic, to be able to access who the owner is given that number. My favorite thing that I've heard about microchipping is that it's a GPS tracking device and the government can track you. That is inaccurate. For reasons I've already explained, the government cannot track your microchip. It has nothing to do with tracking whatsoever. If your pet gets loose, no, you cannot pull up your microchip and find out where your pet is. It has nothing to do with tracking whatsoever. It is simply so if your pet is found, brought into a vet clinic or a shelter, we can pull the information, get that chip number, we can reunite it with a pet. No, you cannot track it with a microchip. That information is not on the chip. So if you guys have any questions at any point when you watch this in the future, feel free to always reach out to me. Usually email is the best way to get a hold of me, just because I do receive a high volume of questions and different things from everyone, and that is absolutely fine, but email is the best. I try to get back to you guys within the same day or the next day, very latest. So definitely reach out if you have any questions. Hopefully I answered a lot of things, or provided you insight with some things you didn't even know about. But that's kind of the overall view of health and wellness that we're dealing with at the Humane Society. So thank you guys that have come on here to watch, and thank you guys that are going to be watching later on.